Hi guys, my name is Shakina Middleton and I'm here to do a personal testimony for Pr1me movement and Dr. Chad and Anthony who make up the staff at Pr1me movement. I am a registered nurse. I've been a nurse for the past 20 years in ICU, critical care, and I'm also an aerobics instructor. I teach indoor spin classes and body pump classes. So in I want to say it was the end of 2018, I had to have knee surgery on my left knee. I had a lateral knee release because my knee was dislocated. I had broken off cartilage removed from my knee, and I also had microfracture to help repair the cartilage. So it was an extensive knee surgery, which I was told would take a good 3 to 6 months for recovery. Well, it did not. It took much longer than anticipated, and I was given a lot of restrictions by my surgeon, so it was really depressing. Well, I underwent traditional physical therapy the first 3 months, and I saw literally no recovery at all. I was still using crutches. I was still in excruciating pain. My range of motion was very limited. My walk, my gait was far off. So I met Dr. Chad, and he just convinced me. He said, "Hey, just come to the office. Let's see what's going on, and I will try to get you back to your baseline." So at that point, I was totally out of ideas. I felt like I would probably have to have a total knee, that I wouldn't be able to teach my classes, that my job would be limited because being an ICU nurse, we're on our feet 12 hours a day. So I went to see Dr. Chad, and needless to say, gosh, after the first 2 months, I was back in the gym teaching my classes. And right now, I'm pretty much back to where I was before my knee surgery, which I would not have envisioned during this whole process right after my knee surgery. So I'm going to show you guys a little of what I'm now able to do with the help of Dr. Chad, going to my physical therapy treatments, which are all one-on-one with him. He takes up the full hour. It's just you and him, and he literally works with you and your injury to help get you back to where you need to be. So I'm going to take off my knee brace. I wear my right knee sleeve just for support every time I work out. I normally keep my left knee brace on as well whenever I'm working out, but I'm going to take it off right now. I see Dr. Chad around once a month just for preventative therapy, which really does help. So I teach my spin classes still. When I first started teaching, I wasn't able to stand up. And now with a little bit of tension, I'm able to stand up. No pain. Feels really good. And I wouldn't have thought I would be able to do this 6 months after my surgery. And I can also now implement a full sprint, which is something my surgeon, even though he was really good, he told me, "Oh, you'll never be able to do a sprint again, Shakina." I'm sprinting. Yes. 150. So I'm going to come off the saddle. And I'm able to also do squats. Even though I'm still working on these with Dr. Chad. And I can do pulses. And this knee does not hurt. So, I'm saying all of this to say that if you're at the point where you're really discouraged and you feel like your physical therapist or whatever firm you're attending is not attending to your needs, Pr1me movement will get you back to where you are post-injury, pre-injury. So I highly recommend them. They're very professional. I've never had any scheduling issues. They're very prompt. They answer all of your questions. Dr. Chan is very knowledgeable about anything joint related. He's just a master at physical therapy, the way the body should move, the way your body was intended to move. So I've been 100% satisfied with their sessions, and I would honestly recommend anyone to see them who needs any kind of physical therapy. Thank you so much, Prime Movement.